7 early warning signs of IVDD every dog owner should know. What if I told you that many dogs don't become paralyzed without warning? In fact, most dogs with IVDD show subtle warning signs first. They stop jumping on the couch, they tremble, they cry out once, they walk just a little differently. Problem is that these signs are often mistaken for aging, arthritis, or simply having a bad day. By the time many owners realize something is seriously wrong, spinal cord may already be under significant pressure. Stay with me, because today I'm going to show you the 7 early warning signs of IVDD that every dog owner should know. And at the end of this video, I'll explain which signs mean you should schedule an appointment with your veterinarian and which ones mean you should go to an emergency hospital immediately. Hello, I'm Dr. Gaemia Tracy, a board-certified veterinary neurologist. Every week, I care for dogs with spinal cord disease. Some come in with mild neck or back pain. Others can no longer walk by the time I meet them. One of the hardest things I hear from owners is this: I wish I had known those were warning signs. That is exactly why I created this channel. My goal isn't to scare you, it's to help you recognize the whispers before they become screams. Because when it comes to IVDD, recognizing the problem early may give your dog more options and a better chance for recovery. Let's get started. Sign number 1, reluctance to jump. First warning sign is one of the easiest to overlook. Your dog suddenly stops jumping onto the couch. They hesitate before getting into the car. They avoid the stairs, or they stand next to the bed waiting for you to lift them. Many owners assume their dog is slowing down because of age, but dogs are incredibly good at hiding pain. Instead of crying, they often simply stop doing the things that hurt. Jumping requires the spine to flex, extend, and absorb force. If one of the discs in the neck or back has become painful, your dog may decide that jumping simply isn't worth it anymore. Any sudden change in your dog's willingness to jump deserves your attention. That doesn't necessarily mean IVDD, but it does mean something has changed. Sign number 2, shaking or trembling. If your dog is shaking, don't automatically assume they're cold. Pain is one of the most common reasons dogs tremble. Painful spinal disc causes muscles to tighten, making many dogs shake even when they're warm and comfortable. Owners often tell me, "He's been trembling all evening, but nothing happened." Actually, something may have happened. Your dog just can't tell you. Instead, they're communicating the only way they know how. If your dog is trembling without an obvious explanation, especially if they're also acting differently, it's worth having them examined. Pain is often your dog's first whisper, but the next sign tells us exactly where that pain may be coming from. Sign number 3, neck or back pain. Dogs are masters at hiding pain. Many never cry at all. Instead, they show us in subtle ways. They hold their head lower than normal, they refuse to turn their neck, they arch their back, they walk stiffly, they hesitate to lower their head to eat, or they simply become quieter than usual. Never ignore a sudden change in your dog's posture or comfort, especially if they belong to a breed that's at higher risk for IVDD. Now let's talk about one of the signs owners remember the most. Sign number 4, crying out. Many owners tell me, "He screamed when I picked him up," or "She yelped jumping off the couch." That sudden cry can happen because movement briefly increases pressure on an injured disc. Now, one isolated yelp doesn't necessarily mean IVDD. Dogs can cry because of muscle injuries, arthritis, or even a sore paw. But repeated episodes or crying out together with stiffness, trembling, or reluctance to move should never be ignored. One thing I don't recommend is pressing along your dog's back trying to find a painful spot. That may increase discomfort without giving you useful information. Instead, keep your dog quiet and contact your veterinarian. Now, we're moving beyond pain. The next signs tell us the spinal cord itself may be starting to become affected. Sign number 5, wobbliness. If your dog starts walking like they're drunk, pay attention. Owners describe this as swaying, crossing the back legs, stumbling, or losing balance around corners. These are neurological signs. They tell us that messages between the brain and the legs may not be traveling normally. This isn't a normal part of aging, and it isn't something you should simply watch for several weeks. Progressive wobbliness deserves prompt evaluation. The next sign is even easier to miss. Sign number 6, dragging the toes. This is one of my favorite signs to teach because many owners never notice it. Listen carefully the next time your dog walks on pavement. Do you hear a scraping sound? Look at the toenails. Are 1 or 2 becoming unusually worn, especially the middle ones? Instead of lifting the paw completely off the ground, some dogs become scuffing the tops of their toes. This tells us that the spinal cord isn't communicating normally with the feet. The dog may still be walking, but the nervous system is beginning to lose precision. It's one of the earliest neurological abnormalities I often find during an examination. Sign number 7, weakness. Weakness doesn't always begin dramatically. Sometimes your dog struggles to stand after resting. Sometimes they slip on hardwood floors. Sometimes they tire much faster on walks. Or maybe one back leg just doesn't seem as strong as the other. As pressure on the spinal cord increases, weakness can progress. Some dogs begin falling. Others lose the ability to stand. And in severe cases, paralysis can occur. That's why recognizing the earlier warning signs is so important, because dogs often whisper before they scream. Which dogs are more at risk? Although IVDD can affect almost any dog, certain breeds are much more commonly affected. Dachshunds, French bulldogs, corgis, beagles, shih tzus, Pekingese, basset hounds, and several others. If you own one of these breeds, I encourage you to become familiar with what's normal for your dog. The sooner you recognize a change, the sooner you can seek help. What should you do? If your dog develops neck pain, back pain, repeated trembling, toe dragging, weakness, or reluctance to jump, schedule an examination with your veterinarian as soon as possible. Till they're evaluated, restrict their activity. Avoid running, avoid jumping, avoid rough play, and avoid repeated trips up and down the stairs. However, if your dog suddenly cannot walk, is rapidly becoming weaker, or loses the ability to use one or more legs, that is an emergency. Those dogs should be evaluated immediately. If there's one thing I hope you remember after watching this video, it's this: dogs often whisper before they scream. Those subtle changes are your dog's way of asking for help. Learning to recognize those whispers may make all the difference. If you found this video helpful, I'd like to ask one small favor. Share it with one person who owns a Dachshund, French Bulldog, Corgi, Beagle, or another breed at risk for IVDD. You never know whose dog you might help by sharing this information. And if you want trustworthy information about IVDD, spinal health, treatment options, and ways we may be able to reduce the risk of disc herniation, subscribe to the Spine Shield channel. Every week, I'll share practical, evidence-based information to help you recognize problems sooner, make informed decisions, and give your dog the best chance at a long, active life. I'm Dr. Gaemia Tracy. Thank you so much for watching. And remember, because one jump shouldn't end a lifetime. I'll see you in the next video.